Welcome to Heart-Based Medicine's Insights podcast, featuring Dr. Karena Wu, owner and clinical director of Active Care Physical Therapy. What is heart-based medicine?
Heart-based medicine means to me the providing of whatever discipline in healthcare and pulling in a greater awareness of your heart and components of your heart and different energies and things that we bring to the table that might be intangible, sometimes tangible, but things that, what I was saying in my lecture, give your service that little bit of extra, which we like to title the heart and the love and the compassion, but bringing all of that into whatever service you're providing so that the experience for the patient and the healing process that they're going through is significantly elevated.
How can a heart-based medicine approach positively impact on medical practitioners?
So that is a difficult question to answer, because if you're working for a different type of company that doesn't emphasize that, yes, it is going to be difficult to bring that in. However, most oftentimes people who've gone into healthcare are there for a reason. You went in to help someone else. So it's very giving, right? It's not about receiving back. We typically have not done it for the financial compensation, but so that you can last in the long term with your care, you need to take care of yourself. So when you're talking to people who are running around like that, who have a difficult time harnessing that extra energy into that, they have to be informed and educated about the self-regulation and the self-care that's really needed when it comes to whatever profession you're working in.
When should a heart-based medicine approach be learned?
I think it needs to be ground up. It needs to be in the curriculum. So whatever curriculum you were in. I'm a physical therapist. We go through our set curriculum. We learn basic anatomy, physiology, all of those components of the body that we treat every single day. Then we learn about diagnostic imaging, clinical decision making, and we need to have a full course in activating you as the person working in this job in whatever profession it is, and utilizing that, harnessing that so that you can create stronger bonds and deeper bonds with your patient, because it truly facilitates the healing process.
What does the concept of being present with a client mean to you?
So some of the components that I said in my lecture were being very open, being interested, sharing information, being detailed and full in your communication. When you're with someone, you need to be with them and focused. And it's in Western philosophy, it's definitely much more in Eastern philosophy. There's a reason why yoga and even Pilates as an exercise is super powerful in both what it can do for you physically, but what it can do for you energetically, spiritually, and mentally. And it's because you have to have so much focus on yourself and at the present, and not in the, oh, I forgot to buy the soy milk, right? So you're present, you're focused, and you're focusing on yourself. And when you're doing that, you're also being a peer and at the same level of the patient that you're treating. So when you are in that zone with the patient, your bond is going to be created, and there's going to be an openness and sharing and a depth of healing that can occur.
Clients also benefit from embracing this approach.
Yes, because as a physical therapist, we teach exercises all the time. We are known as the stretch and strengthen queens, but we're also giving them tremendous education. Again, it depends on the individual, it depends on the company or the facility that you're working at, but if you can teach the patient to actually prioritize themselves, then that again facilitates the healing process, elevates them in whatever capacity, spiritually, energetically, physically, right? I'm looking at physical restoration, but I need them to focus on themselves and be present. And not completely discount the 3 kids that they need to attend to and the husband at home, but there needs to be a little bit of a shift in the care that they give themselves, because they're looking from you as a provider to help them heal, but they're not putting enough time and energy in themselves.
How do we practice a heart-based medicine approach?
So when we're trying to open up our heart, I think we need to also tap into ourselves on a personal level and whatever professional level that they're at. So we've all grown up with whatever personal experiences in whatever country, environment, educational system. Have we traveled the world? Have we had that ability to? Have we been bullied? Have we had traumas too? There needs to be a greater awareness of that person in the heart, because you can't just open your heart unless you're truly an open person that accepts things, understands the things you can control and the things you cannot control, and then understands on a deeper level out there in the big universe and the energies. You can't marry all of them and then move from one, shift to another, versus being very rigid in whatever, school of thought when it comes to trying to heal someone. So when you're trying to bring your heart into play, you need to access other components of you as a being and what you've gone through. They take, obviously, their schooling, whatever the schooling is, because you need the science too, but you need to marry it with the other components, the deeper energy levels, the past life experiences, or past experiences in life, and take that greater awareness into how you connect with the patient, so that whatever service you're giving encompasses those other components, because that actually might be what that patient needs to heal. Not necessarily just the science of it, it's the other relatability comments, those things, being able to use their mind more to heal. That helps the patient, and that's what they need to harness more in their care, in the application of science.
What kinds of resistance to this approach have you encountered?
I think people don't want to share their information. They might be embarrassed. I used to be embarrassed about where I came from. I grew up in a very white Jewish neighborhood and a very Persian Jewish neighborhood. I was a minority. I had a very tough Japanese mother who I appreciate tremendously for the lessons she gave me, but they were tough growing up. And when you're younger and you're not as secure, you want to hide behind those things, so you hide them, and I don't attend to them. And it messes people up in the future. So what happens is, I think if you are more aware of those things and you can bring them to the forefront and attend to them, yes, that's going to require probably some healing from the inside out, but that will come through when you're caring for a patient. I have not found resistances to it. However, I have not done a lot of training in it. I have always done a tremendous amount of clinical training, very scientifically based, applied to the patient. However, in the style of physical therapy that I practice, it requires a lot of clinical reasoning. So you have to have foundational information, and then you're applying whatever you need to a live person in front of you. So there's no resistance, and in our style of physical therapy, you're never wrong if you can clinically justify what you're doing. And it makes logical sense. If it's completely illogical, obviously no other sane person would say yes to doing that. But when it's applicable, it's something that can happen, and it's something that can have a positive effect. And the whole point is positive effects in healthcare. We're trying to make changes in people who happen to have some sort of injury or condition and make them not have that injury or condition, ideally, right? We're trying to restore, right?
What breakthroughs have you experienced in your practice?
The one thing the breakthrough that I've seen is that there needs to be more of this, distinctly much more of this in every single discipline. You can find more of those innate qualities of those who obviously carry their heart forward in healthcare. And then you see those that don't because they've really somehow or another managed to get shifted to the salary that they get and this being a job that they do every day. And it's a breakthrough. I won't say it's tremendously good or tremendously bad. It just is what it is. But the whole point of this summit, right, is to create more of the shift so that there's greater awareness, so that the patient cares better. So it's a different style of doing it. Love is definitely a powerful thing. Love is very something that's an emotion that is suppressed in me because of my background and my experience. But I found that when I'm tapping into that, I'm a very left brain person. Tapping into my right brain actually gives my life a little bit more balance. And I'm finding at this stage that I'm finding a purpose. And my purpose is now to be able to share it. And I think that's one of the reasons why I opened a clinic in India, is because there is not as much access to higher quality care. So yes, education is different in the different countries, but there's also the lack of the heart in it. So if you're not able to access that, you want to be able to share that. And so you want to share both the training and both the compassion of the training, because again, they've all gone into that profession with ideally an underlying reason of just trying to help people get better. So the breakthrough is I feel like I'm on my life path now where I'm going more to education and trying to spread the word, because there's plenty of people that we all can treat, and you just want to do your best effort and give forth your all, because it just makes it a positive experience for both the provider and the patient.
This has been a Heart-Based Medicine production. Thanks for listening.